Have you ever noticed that your mood swings wildly and suddenly, like journeying from extreme happiness to deep sadness in just moments? Have these mood swings troubled you or someone you know? And do you worry about why this happens? If these questions are on your mind, then you are in the right place. Today we will discuss a very important topic, which is bipolar disorder. This is an issue that remains hidden in many people's lives. So let's understand this topic. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. So, the first question that comes up is, what exactly is a bipolar disorder? Let's start. Bipolar disorder is a mental health condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. These mood swings can affect sleep, energy levels, behavior, judgment, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. I hope you now have a slight idea about what bipolar disorders are. Now let's move on to the next point, which is, how many types are there? Let's take a look. Let's see how many types there are, friends. Although there are many types of bipolar, here we are going to discuss some specific points, starting with bipolar 1. The mood is so high that it creates problems, and sometimes so low that nothing feels good. Next, bipolar 2. Here, mood swings are less severe, but the depression is deeper. Next, cyclothymic, mood swings continue but neither too high nor too low, yet this condition can persist for many years. These were some of the main types. Now let's move forward and know its symptoms. Just as there are many types, there are also many symptoms, but here we will look at some common symptoms. So, let's start with the symptoms of mania. Symptoms of mania: overconfidence, taking too much risk, and very little need for sleep. Next, symptoms of depression: sadness, loss of interest, and not valuing oneself. Next, physical changes, changes in sleep, fluctuations in energy levels. Next, behavior changes, anger, irritation, or avoiding people. These are some common symptoms. Now let's move forward to where we will learn what causes it. Friends, there are many reasons for bipolar disorder. Here we are telling you about some common reasons found in many people, starting with genetics. If someone in the family already has it, the chances increase. Next, brain chemicals. The balance of chemicals in the brain gets disturbed. Next, environmental factors. Stress, financial problems, or troubled relationships can also be reasons. Next, life events. Losing a loved one or losing a job. Friends, these were some common reasons often found in people. Now let's move to the next points where we will learn how it can be prevented. In the case of bipolar disorder, if there is a genetic risk in someone's family, this disease cannot be completely prevented. However, we can reduce the severity of this disease and prevent it from becoming severe. Some steps are taken to prevent bipolar disorder, such as information, understanding, and awareness are the first steps. Next, early intervention. Consulting a doctor as soon as symptoms appear is very important. Next, lifestyle changes. Adopting a healthy lifestyle can reduce the risk. Next, support system. The support of family and friends is crucial. By following these steps, you can prevent bipolar disorder. Now let's look at the next points and understand how its diagnosis is done. There are specific ways to diagnose it, such as medical history. The doctor takes your complete medical history. Next, symptoms analysis. Your symptoms are understood in detail. Next, physical examination. Sometimes tests are done to rule out physical problems. Next, psychological evaluation. Mental health professionals assess your psychological condition. Friends, these are the ways to diagnose it. Now let's move to the main points where we will see how it is treated. Friends, the treatment of bipolar disorder is done through a mental health psychiatrist. So let's see: psychotherapy, talk therapy, which makes you feel better. Next, lifestyle management, paying attention to sleep, exercise, and diet. Next, emergency treatment. Sometimes hospitalization may be needed in severe cases. Next, medications. Treatment often involves mood stabilizers and atypical antipsychotics, which help control mood fluctuations. Friends, these are important points through which bipolar disorder is treated. I hope this video will be very helpful for you. Lastly, let's look at its conclusion. Friends, understanding bipolar disorder and getting the right treatment is very important. If you or someone you know shows such symptoms, do not hesitate to seek help. Also, discussing it to spread awareness is also our duty. I hope, friends, you will like this video and understand bipolar disorder well. If you feel any points are missing in this video, please let us know in the comments box and share your strategies. Your health is important to us. Thank you. Keep watching, keep learning.